Hello, this session is on the reproductive system. My name is Caroline, and I will be your guide as we talk about the reproductive system and the issues that are involved. Now, the first thing I will go over are things dealing with fertility and gynecological problems, and the first area is that dealing with infertility. Infertility has been described as the inability to conceive after at least a year of unprotected sex. So, when a couple has been trying to get pregnant for a year with no results, that is when we use the term infertility. Now, this affects at least maybe 10 to 15% of all couples. This means that they have difficulty getting pregnant when they want to, and this doesn't mean that they will never get pregnant. It's just that some of these couples will have a pregnancy, but not at the time that they had truly planned for. Now, at the time, it is very important to test both the female and also the male. Statistically, problems are likely to be more male-related as female-related. I'm not going to go through that in the diagnostic tests for that because I haven't seen that being covered a lot in Nclex. But what you might want to review, if you feel inclined to do so, would be those issues. Now, however, I do want to go over the issues about the use of fertility drugs. As oftentimes, if women are not ovulating well, sometimes they're given those fertility drugs. Now, drugs like clomiphene or Clomid tell us about the major side effects of those two medications with the cartoon. So, it says, double your fun, double your pleasure, double your fun, get 2 for 1. So take clomiphene. Clomiphene is C-L-O-M-I-P-H-E-N-E. Clomid, and that one tells us the major side effects would be multiple births and twins, or even triplets or quadruplets, because the fertility drugs stimulate ovulation a lot, and in that process, more than one egg gets fertilized. So, I think they have questions on the exam about Clomid and its side effects, and mostly it's about one of those big side effects for this medication would be the ovarian cysts. Now I want you to go to the opposite issue, and I want to talk about contraceptives. So when people want to control their pregnancy or control fertility, then they get to make that decision when they want to get pregnant, in a way. And things like condoms and diaphragms, what we call barrier methods of contraception. So this means that they keep the sperm and the egg from getting together. So, condoms have the additional benefit of helping to reduce the spread of disease. Now, they do not completely eliminate the possibility of diseases, things like HIV or sometimes even STDs and whatnot, but they reduce the spread of disease. Now, condoms are frequently used with spermicidal jellies, and so diaphragms, and so are the diaphragms. Now, the diaphragm is a device. It is a round diaphragm, a round device with a little rubber dome in it, and the woman inserts it before sexual intercourse, and at the end hooks up underneath the symphysis pubis, and the other end goes back behind the cervix. Now, on the dome that is on the diaphragm, that is usually placed with a spermicidal jelly. So, in addition to keeping the sperm and the egg from getting together, you have that extra layer of protection with the spermicidal jelly, which is inhospitable to sperm. Now, they might ask you about teaching a woman using a diaphragm. What are the key teaching elements? And one of the key things is that the diaphragm needs to be left in place for 6 hours after intercourse. So it cannot be removed immediately after intercourse. It needs to be left in place for 6 hours. Another type is the IUD, intrauterine device. Now this is a device that is placed in a physician's office inside the uterus. Now this device can be kind of a T-shaped or a Z-shaped, and it has a little string that goes down through the cervix. Now some of the side effects and problems with the IUD is that it can cause excessive bleeding. The IUD can also cause infection, so it's very important to practice proper perineal hygiene. Because of that strings, because it hangs down the organism, and an organism can just climb right up the string and into your uterus. Now we have to teach the woman who has an IUD to check the place of the string every month after menstruation. And you are wondering, why after menstruation? Well, that's because it gets dislodged around the time of the month as you're going through the crampings of menstruation. An IUD is inserted by the physician and it stays in place until it has to be removed. Now, it is used most often by women who have at least one child. This is not recommended for someone who has never had a child. Another type of contraceptive that I want us to address is the pill. The pill contains progesterone, which is a hormone of pregnancy. And essentially how the pill works is it raises up the progesterone levels high enough that it fools the brain into thinking that a woman is pregnant. So no follicle stimulating hormone, which is the FSH, is produced, and no eggs are produced. Now, any other progesterone containing substances in the same way are the patches or the Depo-Provera. The progesterone has been put into the arms, that has been deposited like little pellets on the arms, and sometimes like they might make a small incision on your arm and stick it there and then cover it back up, and that over time it carries the same principle. Now they just fool the brain into thinking that you are pregnant and therefore no ovulation occurs. We will have some questions in a few moments and we can go over some of those issues with the pills. Now, one side effect you do want to remember is that hormones about your progesterone is sometimes the pills also contain estrogen, and estrogen substance, but not your hormones, can cause clots. So we need to be alert for a woman who has a history of clotting should not receive the pill. The fertility awareness or the rhythm methods of contraceptions have been around a long time, and it basically says you avoid sexual intercourse during your fertile periods and just before or after ovulation. It is the only method sanctioned officially by the Roman Catholic Church, so that from that perspective there may be a lot of people that are attempting to use this method as contraception. Now, you should know that typically a woman may ovulate day 14 of the cycle, and then there is day 14 days after the ovulation of the menstruation. That 14 days from ovulation to menstruation is pretty consistent, and I don't want to tell that women don't always start their periods every fourth Tuesday at 10 o'clock in the morning or 11. There's some variability in that it might start on Monday or Sunday or even Thursday, so there's a variation on when it starts. And the variable time from menstruation to ovulation, therein lies the problem. So if a woman wants to use the fertility awareness or the rhythm method of contraception, we have often encourage them to monitor their basal body temperature. Now we will have them take it every day before they get out of bed, before they do any activity, so it's basal body temperature, and chart it. So we know just before ovulation there's usually a little dip and right after ovulation, there's a sharp rise in body temperature, a good 0.5 degree rise in basal body temperature. Now that rise says that this is when the egg is beginning to be produced and the ovulation time. So let's say that the woman has been monitored and her basal body temperature has been determined over the space of 6 to maybe 10 months. She ovulates somewhere between day 12 and day 17. So that is her range, let's say 12 to 17. So now let me ask you, how long do sperm live? And the answer to that is it may live up to 72 hours. So if the woman abstained on the day of ovulation, and that's fine, but she had had intercourse on the day before, those little sperms have worked their way right up, and by now they're at the end of the fallopian tube where that egg is being produced. They go and gotcha! Contraception occurs. So a woman should abstain for 3 days prior to ovulation, and then how long does an egg live for? 24 to 48 hours, which means that she needs also to abstain up to 2 days after ovulation. So let us take this woman who's ovulating between day 12 and day 17. So to be sure that she's not going to get pregnant, we have to abstain from days 9 to day 19, and that is how fertility awareness type thing works. Sometimes we can also look at the vaginal secretions, and when they're nice and stringy, this suggests ovulation as well. We still have to that concern about 3 days before, and that is a big problem with these types of methods of contraception. Now let us do a question. A 17-year-old girl asks the nurse about using a condom for birth control. Now, what is the most important information for the nurse to provide her? 1. Use petroleum jelly as a lubricant. 2. Apply condom to penis just before ejaculation. 3. You don't need a medical prescription. Or 4. Apply condom before any penile or vaginal contact. And I'll wait for the answer. 4. Apply condom before any penile vaginal contact. Now, petroleum jelly is just a big no-no. Any kind of lubricant should be water soluble. I want you to remember that it has to be water soluble. Now, petroleum lubricant or petroleum jelly is going to disintegrate the latex. So we have to use a water soluble lubricant. It is true that you don't need a medical prescription. However, this is not the most important thing to tell a person. How to use them properly is the most important thing to tell this young woman. Now, this is a different question. A 19-year-old comes to the clinic for contraceptives and asks about the pill. Which question is most important for the nurse to ask when discussing the pill? 1. How much exercise do you get each day? 2. What do you usually eat each day? 3. How many cigarettes do you smoke each day? 4. Do your parents know you're here? And the correct answer to this is, how many cigarettes do you smoke each day? Now, if a person smokes more than half a pack of cigarettes, they really should not be using the pill because it increases their risk for thrombus or thromboembolic complications. Now, I suspect that there are a lot of you that thought about maybe, for example, what if the question changed and the patient was a 15-year-old? And then you'd wonder, 15-year-old will lie to the gynecologist about their use of cigarette. Now, there's an answer to this question that may have concerned you, and that is probably the fourth answer. Do your parents know that you are here? So for example, if the child was 15 and you looked up and said, you know, this one's probably young, and you might think, do I need a consent to go over this sexual teaching or the reproductive issue teaching? However, a young woman of probably 15 or 13 can go and get contraceptive information, even an abortion, without the parent's knowledge. And that's the way the laws are in the United States today. Now, another question for us would be, a young couple was discussing birth control with the nurse. When selecting the method of birth control, the couple should give priority to which factor? 1, the woman's age. 2, the length of their marriage. 3, the technique they might find most acceptable. Or 4, the success rates of a particular method. And the answer is 3. The technique that they find most acceptable. It is important that whenever a method is chosen, that they will use it. Now, if a woman says, I can remember to take a vitamin pill, I can't take a pill every day, then the pill is not the best choice for them. Simply because if a woman says, I can't touch myself, then probably the diaphragm is not an option for them either. Or if a man says, hey, it's your problem, I don't want anything to do with this, then you're the one that gets pregnant, then using a condom is not an option in that relationship. So it's very important to consider what the couple is willing to use as a contraceptive methods. Now, most methods of contraception, when used as dictated, have a pretty high success rate.